Community health centers encompass a national network of about 1,400 primary care providers. They are primarily found in rural and underserved areas where affordable medical care is lacking. They offer an array of services to patients. These services are made available even if patients are unable to pay. Primary care services may include medical treatment, behavioral support, and other services that may be necessary. Community health centers play a pivotal role in alleviating financial hardship. Many individuals who utilize community health centers are from low-income households or have a racial identity that is minoritized. Therefore, these centers serve as a crucial lifeline to increased well-being and healing. People of color may be conditioned to feel as though they are undeserving of care. Community health centers welcome these populations and provide support through a culturally competent lens that affirms them. They also advocate for legislative change and promote health equity. Overall, community health centers aim to adequately serve and uplift those who utilize services. This will be discussed more thoroughly in upcoming portions of this presentation. Community health centers leave their mark in every state, illustrating their dedication to providing care for all populations, including those who are uninsured, underinsured, or living in urban neighborhoods or rural areas. Community health centers play a role in providing treatment to those using Medicaid. It is discovered that community health centers serve 1 in 4 Medicaid patients nationwide. These centers do not negatively affect Medicaid-based expenditures. In 2024, it was reported that Medicaid spending rose to about $919 billion. Meanwhile, community health center based Medicaid expenditures reached about $23 billion. This emphasizes the center's ability to provide high-quality treatment that is relatively affordable compared to the cost of the program. In addition, it should be noted that community health centers provide unparalleled access for people who may be struggling financially or who have chronic health conditions who need affordable care. The access to care that these centers provide decreases patient risk and prevents expensive emergency room or hospital stays. Overall, the cost-effective model for which community health centers align with greatly benefits patients and produces savings for Medicaid. This is done concurrently as community health centers strengthen continuity of care, strive for injury prevention and safety, as well as improve health outcomes for all. The accessibility of primary care is crucial as it helps individuals prevent and manage their chronic health conditions. Community health centers play a pivotal role in granting this access and decreasing racial disparities in healthcare. It was found that those from neighborhoods containing predominantly Black individuals experienced healthcare-based inaccessibility. The Patient Protection and Affordable Care Act has taken many meaningful steps to ensure that low-income communities and minoritized populations have insurance coverage. They have also provided funding for community health centers, enabling them to maintain their operations. However, these advances still bring about concerns that are unique to healthcare systems, such as extended wait times or long commute times. Community health centers alleviate these issues by densely populating underserved areas in need of medical support. In recent years, the Patient Protection and Affordable Care Act has actively increased funding for community health centers to elevate access to primary care in minoritized and underserved areas that are in need. As previously mentioned, literature illuminates that community health centers decrease hospitalization rates um, among at-risk populations and lower the utilization of emergency rooms. The decreased need for these services indicate that community health centers sufficiently address medical needs before they worsen. This is unlike standard medical facilities that may limit access to certain services based off of race, culture, background, or status. It has also been found that states with a higher number of community health centers actively lessen racial disparities relative to health outcomes. Their presence is much needed, as researchers note that neighborhoods containing minoritized populations are at a high risk of being subjected to healthcare-based inaccessibility. This risk exists even with the presence of community health care centers and increases in their absence. Overall, these centers provide comprehensive care to patients that minimizes existing risks and helps enhance patient health and well-being through access to various services. Medical debt is a prominent issue in the United States that impacts millions of Americans. It refers to expenses accumulated due to medical treatments. These treatments may include hospital stays, surgeries, medical checkups, or other costs related to treatment. It has been found that those most vulnerable to medical debt are those who are uninsured, underinsured, or from minoritized populations. Therefore, the challenge associated with alleviating this debt is even more unrelenting for these populations. A common misconception is that uninsured or underinsured individuals won't be subjected to high healthcare costs. This is false, as not everyone has access to care that offers low price treatment. Government data notes that about 9% of adults have amassed over $250 in medical debt. A study reported that around 85% of uninsured adults over 65 are more likely to experience challenges in affording health care costs. This number is quite high compared to the 47% who have health insurance. It was also found that at least 6 in 10 Black adults and Hispanic adults expressed difficulty managing care costs compared to about 4 in 10 white individuals. Adults in low-income households are more than 3 times as likely than individuals in high-income households to reveal difficulty affording medical expenses. In order to address this medical debt, we must identify factors that generate it. According to key findings, visits with specialists and emergency room visits most commonly contribute to difficulty paying medical costs. Other factors that exacerbate the issue include expensive medications and the incorporation of expensive technology in medical treatment. Community health care centers can help by providing affordable health care that breaks down these financial barriers and fits the patient's needs. Studies also recommend implementing medical debt forgiveness programs. While these programs have not been implemented yet, community health centers have significantly diminished patient debt by increasing affordability and providing care regardless of insurance status. Optimus Healthcare is located in Bridgeport, CT. They are the largest provider of primary health care in southwestern Connecticut, ensuring accessibility for all patients. Optimus has a wide range of services, including primary care, dental services, behavioral assistance, and specialty healthcare. Offering this array of services ensures that patient health is prioritized and maintained. Optimus also aligns with the cost-effective model that many community health centers adhere to, offering patients care regardless of one's ability to pay. This agency also operates using a unique model of care, the patient-centered medical home with enhanced services model of care means that Optimus serves patients from all backgrounds and socioeconomic statuses. They have multiple locations with extended hours and offer telehealth services for patients who face barriers to scheduling in-person visits. Optimus places a deep emphasis on confronting social determinants of health through their practice. They achieve this by working collaboratively with agency personnel to combat systemic issues such as housing instability, food and clothing insecurity, and medication-related expenses. All of these challenges pose as barriers to receiving healthcare. Optimus Healthcare works diligently with agency members and other relevant figures to break down these barriers to promote health and healing for all. Pediatric Care Program at Optimus Healthcare serves patients from birth to age 21. It offers an array of pediatric services, including child well care, immunizations and vaccine services, acute care and same-day appointments, telehealth, infant health, behavioral health support, nutrition and obesity programs, chronic disease management, school and sports team physical exams, school-based care, and WIC programs. This area of care uses an integrative approach. Agency personnel coordinate patient care across different specialized areas. Optimus Healthcare offers a variety of services through their adult primary care program. These services include adult medical care, acute care, and same-day appointments, wellness and prevention services, management of chronic conditions, and pharmaceutical or medication therapy management. Optimus also has other primary care partners. These include podiatry, acupuncture, chiropractic, and nutrition services. As always, Optimus emphasizes their mission to treat patients regardless of culture, race, or socioeconomic background. People from all diverse backgrounds are welcome. Through their treatment approach, Optimus strives to take on a holistic approach when treating patients. This involves examining all systemic, environmental, social, or personal factors that may be affecting a patient. Optimus also believes that it is of the utmost importance to use evidence-based care that is deemed credible by researchers. This ensures that patient care remains efficient and optimal. Lastly, this program works to seamlessly blend different systems of care in order to create an approach that is person-centered. The Women and Children's Program at Optimus Healthcare offers support to low-income new mothers and infants with children up to 5 years old. WIC also offers additional resources that can assist with supplemental food, nutrition education, and help with breastfeeding. The WIC program's main services include a one-on-one consultation with a nutritionist to discuss diet and health, breastfeeding support and associated information, opportunities to meet and make connections with other families, referrals to healthcare services, and behavioral health agencies, alongside an eWIC card to purchase healthy food for you or your family if that is needed. Eligibility for services is as follows. Those experiencing a pregnancy or those who are in its aftermath are eligible. Those experiencing the postpartum period, this means up to 6 months after the birth of an infant or after the pregnancy ends. Um, those who are breastfeeding or have an infant up to 1 year old are also eligible. Infants can receive WIC up to their first birthday. Children up to 5 years of age are also eligible for this program. Optimus serves women approaching their childbearing years up through postmenopause. Services for women include pregnancy counseling, pre- 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 prenatal care, gynecological care, lactation support, ultrasound and laboratory services, cancer screening, counseling, family planning, menopausal support services, breast exam, and referrals for bone density exams. Optimus strives to maintain a continuum of care. Agency personnel will work collaboratively to care for patients throughout the duration of their treatment. They also make it a point to treat patients with understanding, refraining from operating out of judgment. Those who belong to minoritized populations and communities often struggle to manage their prescription drug costs as systemic and geographic barriers often make this difficult. The the 340B drug pricing program helps to generate funds that go directly to Optimus Healthcare when patients visit their partner pharmacies. These funds help to elevate patient care and allow Optimus to care for more patients. Uninsured patients can also receive their medications at decreased rates. Optimus has many partner pharmacies near the Bridgeport area. The mission and treatment approaches used by Optimus Healthcare illustrate how community health centers work to use affordability and the awareness of health equity-related practices to promote patient safety and well-being. The usage of integrative care approaches demonstrates that Optimus Healthcare is skilled in adjusting patient care if it does not align with patients' preferences or yield desired results. This reflects the usage of a culturally competent lens, as Optimus works collaboratively across the disciplines to meet the needs of its patients through approaches that do not seek to ignore how patients have been affected by systemic inequities. Community health centers like Optimus push back against these um, systemic systemic inequities and create environments where patients are welcomed and seen as a whole person. In a broader sense, community health centers engage in these same practices as they make care accessible through their location. They engage in cost-effective pricing and the acceptance of diversity.